Well, hello, Facebook friends. We are live right here at Scottrade Center. My name's Darren Pang. I'm the voice of the St. Louis Blues on Fox Sports Midwest, and proud to be a part of the great broadcast team. And I am joined now by, he needs no introduction. Look at the big fellow over there. That's Louie. That is the official mascot of the St. Louis Blues, and he's got everything in order right now. He's in fine shape. But today's a special day. We are joined by Dr. Mark Moon of Washington University and also Barnes Jewish Hospital. Right. Mark, good morning to you.
Yeah, thanks for having us here today. It's a wonderful event.
Well, we are. Yeah, we were looking forward to this. We've got a lot to learn today.
You bet. You bet.
And you're going to teach me along the way.
And with Kristen, of course.
I know that. I know that. And Kristen Seymour, a clinical nurse specialist as well. So thank you very much for joining us.
My pleasure. Thanks for having me.
You notice I'm taller than you?
Yeah. I know.
I'm standing
That's awesome.
I'm standing on.
I can stick around longer.
People that know hockey know that I'm not this tall as well.
I know. That's right.
Well, we alongside the partnership with Barnes Jewish Hospital and the St. Louis Blues, this is an awareness of AEDs within the community. So this is a real special time to make sure that everybody knows what this is and how we're going to relay it. We're also, because we're going live, guys, we got the step-by-step on how to use the AEDs, but also we're going to ask any kind of questions. Bring those questions on board, because as we're going live here, we want to answer those questions and make sure that everybody knows exactly how to work this. And Dr. Moon, maybe you can talk a little bit about our relationship.
Exactly. Well, the Washington University and Barnes Jewish Hospital Heart and Vascular Center are partnering with the St. Louis Blues again this year to bring awareness to Heart Month. And as part of that awareness program, we've developed this I Heart Blues T-shirt. And it's not the Valentine's heart, but more an almost anatomically correct heart. So it can be used in the anatomy classes, I think, at the medical school. But we're selling these in the St. Louis Blues gift shop, and the proceeds are all going to supporting the AED program, which is trying to put AEDs in organizations that need them throughout the community.
Well, Kristen, what is an AED and where can we find them? I think that's a really big question. I mean, it looks like a beautiful red box right here.
Yes.
But we should know more about that.
So, correct. So an AED, it stands for an automated external defibrillator. And what it is, it's just a small, portable device, battery operated, self-testing, inexpensive, that is able to detect the heart rhythm via these electrode pads and a computer chip inside. And if indicated, it will deliver a shock to the heart and restore it to a normal rhythm where it's able to pump blood to the body again. It's always used to treat sudden cardiac arrest. Sudden cardiac arrest is a potentially fatal condition in which the heart suddenly stops beating.
Where can we find one of these?
These are
here we are at Scottrade Center.
Well, there's
beautiful
one right
big
there.
Facility.
There's one right there. There's 3 AEDs at the Scottrade Center. AEDs are usually found in places where people congregate, such as airports, casinos, government agencies, shopping centers, rec plexes, and as I said, there's 3 here. So they're oftentimes at many different places.
Most importantly, to many viewers, I'm sure, is that golf courses are a very important place where these devices need to be.
The golf course is
3rd hole, 18th hole.
You got it.
Are the 2 most common locations.
Why would that be?
Well, the 18th hole
I'm a
is
golfer,
obvious.
so I needed.
Here's why.
It's coming down to the money, but
here's the reason. There was a study done at the University of Pittsburgh that demonstrated that they did a retrospective review of all of the EMS pickups, where the ambulances picked up the patients, and hole 3 and 18 are in fact the deadliest locations. The golf course in some studies is looked at to be the 5th most common location for sudden cardiac arrest. And the reason, to answer your question, is because typically when the golfer is walking, their heart rate is starting to get up by hole 3. And then by 18, they're dehydrated, oftentimes have had alcoholic beverages, oftentimes they're exhausted, and their heart is just demanding quite a bit. So they end up having sudden cardiac arrest. Now, that is all, that's all based on this study that was done about 4 years ago.
You know, it's amazing. We've all seen the people getting shocked on the television in an emergency room, but this device can be used by almost anyone, almost anywhere. And Kristen's going to show us how it's used, but it tells us exactly what to do.
Right.
So even the novice can use it.
Right. Children can repeat demonstrate. There was a study in Maryland where 6-year-olds were able to see this once demonstrated and repeat demonstrate properly.
6-year-olds.
6-year-olds.
So Louie and I can do it.
Right. No, so it's a very easy to use, user-friendly, simple operation that could really make a huge difference in someone's life.
Oh, absolutely. I've got personal experience with that. A close friend of mine 2 years ago was jogging around Creve Coeur Lake and passed away from a sudden cardiac arrest. And if there had been one of these devices there, he might still be here
So
today.
as an example, I'm sure a lot of our Facebook Live friends here are hockey players, older men or women that play over 50 hockey at an outdoor rink. An important part, I'm sure, for minor hockey rinks to have that as well.
Yes.
Because you think you're younger than what you are, you get going.
Absolutely, and absolutely. And also there's a huge incidence of sudden cardiac arrest in athletes, especially collegiate and high school athletes. So I actually used one of these on a student that was swimming at a pool at a school here in St. Louis, and they are incredible. He was resuscitated.
That's fantastic news.
Okay.
We're taking questions. So we do have one right now on Facebook Live. The question is, do you need a CPR class? It's a great question.
That's an excellent question. And in fact, in most states, they require a CPR class to use the device. In Missouri, if you use the device and you're not CPR trained, you can go get the device, come, put it on the patient. You are protected by the Good Samaritan law. In 2010, Missouri was one of the few states that revised the law that you don't have to be CPR certified, because the intent of wanting to help is and trying to implement this device is far greater benefit than not. So that law was revised in 2010. So in Missouri, get it and use it.
And again, this Kristen Seymour, clinical nurse specialist, Dr. Mark Moon, and we're pleased to be able to actually have this information out here on Facebook Live, and we appreciate all the fans, asking questions, because you ask questions, they're good ones. We're gonna knock them out of the park right here. But would you mind? Would you mind showing us exactly? I'm gonna take the water over here.
Okay, so first, before using an AED, there's 3 things you must remember. Number 1, that 911 has been activated, has been notified and called. So if you're alone and you've come across a victim, you should use your cell phone to call 911 and then do the CPR and do this, because of the fact that you need that EMS response. Number 2, ensure that the victim is over the age of 8 or weighs greater than 55 pounds approximately. There are pediatric pads that come in some of these devices that are appropriate for under 8. But just keep in mind, over 8, over 55 pounds, it can be used. And the last and most important thing to remember is that the victim is unresponsive. They have to be unresponsive. No sign of life. Okay. So you come up, Annie, are you okay? There's no response. You don't hear, you don't feel any breathing. You don't feel a pulse. Some people say, I don't know how to check a pulse. Yeah. You just say, are there any signs of life? Okay? So then you get the AED, 911 has been called, this victim is over 55 pounds, and you unzip and open it up, and it comes with scissors. Because most of our victims are going to be clothed, correct? Unless they're at a pool. So here we have the AED unzipped, and there's scissors in here to cut off the clothes. So the AED is revolutionary because it has visual prompts through flashing lights and pictures, as well as auditory. So I'm going to stop talking and let it speak.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Okay, I'm going to hold on. So we're going to cut the shirt off.
Okay.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
Okay. So, thanks, Mark. So, it's off, and this has arrived. But until this arrives, you will start CPR. But it's here.
Remove protective cover and take out white adhesive pads.
Here are the pads. It's all attached.
Carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic lump. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
So, put that on here, and then there's the second pad.
When the first pad is in place,
okay.
No one should touch the patient.
Stand
Analyze.
clear.
No one should touch the patient. Shock advised. Stay clear of patient. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient.
So
Begin CPR. For help with CPR,
you come back and you can check for a pulse and see they're responsive. Many times that one shock will jumpstart, if you will, stop and restart the heart into a normal rhythm where the patient can then breathe and have blood flow. But anyway, this will happen if they do not have any more signs of breathing. You're going to go ahead and do CPR until EMS arrive. Does that answer?
Well, yeah, that's.
Isn't that awesome?
I can't believe the step-by-steps that it gives you, and I mean,
so user-friendly.
I was going to say that. So we've got another question here from our Facebook Live friends and fans out there.
Yes, it can.
Can an AED be used if a person has a pacemaker?
Yes.
It can be used safely with a pacemaker or even a defibrillator if the patient has an internal defibrillator. And the reason that is because the pacemaker will reset itself. The pacemakers are so smart, you're not going to throw its electronics off. It will just continue pacing once the rhythm is back. So once a patient goes into a potentially fatal rhythm,
Because if no one's around, nobody knows.
right, exactly, you
Right.
won't even know if the patient has
Right.
a pacemaker. So
Exactly.
it's very safe.
Good point.
Very safe.
One more thing, if the patient has a medication patch on, many patients have different kinds of patches, you would just take that patch off and wipe with a gloved hand that spot clean before putting those pads on. But I, in my experience, have never had that happen. Typically, it's cutting off the shirt, putting on the pads, turning it on, it analyzes, and it will say shock advised or not. 95% of the time, it will accurately identify a shock in all of the cases. So it's very valid and very reliable.
Can you get?
Cost.
How can you get certified?
You can get. That's a great question. You can get certified with basic BLS CPR classes. This is now included in a basic CPR and basic CPR class.
Okay. Okay, we've got another question as we roll along here from Scott Trade Center. Let me see. How long does an AED device last? That's a good question. How
great
long does it
question.
last? Do you recharge it? Do
Okay,
the
so
batteries?
Yes, it runs on a titanium battery that lasts about 5 years, depending on how often it's used. So, for instance, if you're using it more often, you may have a 3-year shelf battery life. The reason in here, in this top corner, all AEDs, regardless of manufacturer, have a blinking hourglass. The blinking hourglass or blinking signal will show you that it's okay. People who have an AED on site, probably your first aid crew will probably monitor these and make sure daily that this is still good. What will happen is we'll have a red X within that 5 years, typically around year 4 or 5. It'll start blinking a red X. That means the battery's starting to go low, and they have about, I think it's a week to get the new battery in place. The battery is usually located in the back, and it slides right in, and that's the heaviest part of this device is the battery.
How can you get an AED?
Well, you could actually go to Costco and get one for
Love
$1,500.
Costco. You can get everything at Costco. Huh?
I know, that's so funny,
That's
right?
where Louie got his helmet at Costco.
No, you can actually, you can order one online. You can get one anywhere for around $1,000 to $2,500.
Okay.
And some states and some companies require a physician's order, like a prescription for it, because they're high risk. Some people can just get one. I know several people who just purchased them after I did a men's golf dinner for their places of their offices.
Because I'm thinking, you're at, let's say you're at a lake, and you're like me, you're over 50 and you think you're younger, and now all of a sudden you're on the wakeboard and you're doing things. Like, what would it hurt to have one of those right at the
I
place,
call
or
them-
on a boat,
Right.
or
Right.
right?
I call them little lifesavers.
Yeah.
It's a no-brainer.
Yeah, no question about that. We've got another question here. The questions roll on via Facebook. How can you win? How can you win
No idea.
that T-shirt? How can you win that T-shirt?
Well,
Not the
how
one
can you
you,
lose?
not the one that you, not the one that you cut up.
That one we're
But
giving
you
away
can
for
buy
That one we'll give away in
How
a
about
couple
you can buy
minutes.
it? You can buy it.
Huh?
You can buy it.
No, these T-shirts, and the reason we're selling them is for the cause of being able to give organizations in need that can't afford one of these devices, this device, as a gift from the St. Louis Blues and the Washington University Barnes-Jewish Heart and Vascular Center. So we are working together to get these devices where they need to be.
I like it on the back. Call 911.
Yes,
Exactly.
yes, exactly. And
Right.
these weigh, people ask me how much they weigh, and they weigh about not much more than a very small laptop. They're lightweight,
Yeah.
they're very easy to, they're lightweight, they're very easy to manipulate, and they're very simple to use. I think it's kind of a no-brainer for every school and every big, large organization to have one because it's kind of so easy.
I'm going to talk to the Blues trainers, and Ray Barilli's been here a long time, and I'm between the benches, and sometimes the pucks come at me pretty quickly, you know. Sometimes,
for sure.
I might need one down
Right,
there.
I'm
right.
right there in 126, so
Are
I'll
you?
come over there in
as
trouble.
well?
Yeah.
Yeah. So,
Well, what a I mean, this is incredibly informing.
it is. It
I mean,
is.
for some of us that take it for granted every day, I'm around a sports team every day. You see how these trainers are. I've had many surgeries, but obviously this is as severe as it gets and,
Right.
and as traumatic as it gets. And to have the comfort of knowing that you've got an AED right there is
Right.
something special. We've got viewers, let me see. Oh, that's a good
you
one
go.
there. All the viewers that have asked questions, they are eligible and entered to win a T-shirt. There you go. So you've come on board, you've asked some questions on Facebook live, and so you're eligible. So we look forward to that. We got all kinds of sizes too, even big ones like for Louie.
One more kind of fun fact, or not fun, but fact, is that sudden cardiac arrest is the leading killer in among men and women. And so with if you retrieve an AED, and because this is the treatment for sudden cardiac arrest, within a minute, their chance of survival is 90%. And for every minute that goes by, their chance of survival decreases by 10%. So the faster people can just go and respond, call 911, get the AED, the more likely the victim will recover.
And it's not just something that sits on the shelf. I mean, you've
Right.
used this device
Right.
before.
I've used it a couple times.
You have. Okay, now we go through this right now. This has been used. Johnny's safe. Everything's
Yes.
good here.
Uh-huh.
And all the pads are there.
Right.
So are they reusable pads?
That's a great question. The emergency medical response team will arrive
Yeah.
when the ambulance arrives, and the EMTs will come, and they will attach the pads to their monitor, okay, to their machine that will monitor the heart rate and rhythm, and they'll be able to then administer subsequent shocks if needed, and move and bring the patient to the hospital. What will happen here is there's replacement pads. They also have expiration dates. The pads are usually about 2 to 3 years. Now I think they're getting better. It's probably more like 4. But you want to monitor your pads and that battery life. So there are replacement pads and replacement batteries for this. So, did that answer your question?
It does, actually.
Okay,
It does, because
good.
you're thinking, okay, well, now where do I go
Exactly.
now? You know?
And so most of them have this adapter. So it's just very simple for the responder, the EMS.
It's usually, the EMS team is usually there within about 8 to 12 minutes
Right.
on average. And so, but every minute counts. Like Kristen said, if you can get this device used within the first 2 or 3 minutes, you got an 80% chance of bringing that patient back to life.
Well, Dr. Mark Moon, this has been great. I know our relationship with Washington University and Barnes Jewish Hospital is something extremely special. So,
Absolutely.
I mean, this really it kind of personalizes the relationship as well. I mean, having you both here live and
Yeah, it's
with your
great. Thank you.
experiences,
Yeah.
and you're really good at that too, by the way.
That's an experience.
You did a really good job. So we've got some
you.
questions still kind of rolling in, and we've got another one here. Can an AED be used on someone with an
Arrhythmia, yeah.
arrhythmia? Yes.
Well, a lot of people do
I don't
have
use those big words when I'm between the benches.
Well, a lot of people do have chronic arrhythmias, whether it's atrial arrhythmia, which is the upper chamber, or ventricular arrhythmias, which is the lower chamber. This is essentially treating a fatal arrhythmia, or potentially fatal arrhythmia, called ventricular fibrillation or ventricular tachycardia. And that's something that people don't have consistently. So even a patient who has atrial fibrillation, which is a chronic issue, can go into this near fatal rhythm, and it can absolutely be used in patients with arrhythmias.
Have you experienced that?
The whole key is, though, they have to be unresponsive, like you said, with this
Right.
fatal arrhythmia. So when they are unresponsive, yeah, I used it on somebody who had been wet. They fell in a fountain and were very compromised and lifeless, pulseless, dried the victim off. And at that point, when you're really in the moment, you just use whatever you have. Like you take off your own lab coat and dry them off, get them dry, this position and then put the pads on and move forward. That victim survived. And then I know another one that on the golf course who actually the victim was only under 40 years old, and he completely arrested and was resuscitated with an AED.
Okay, and we want to update our fans here as well on Facebook Live here from Scott Trade Center. We are live because that's why it's Facebook Live. But the T-shirts are available in the St. Louis Blues team store. So if you're here at Scott Trade,
They're the cheapest item in the store.
they are the cheapest item in the store. It's for a great cause. There's no question about that. So tomorrow night, let's just say tomorrow night you're here for Bob Plager's sweater retirement. Oh my goodness. Number 5's going to the rafters here, and no one had a bigger heart, by the way, playing for the St. Louis Blues.
absolutely.
That's
Oh,
a
yeah,
big
he's
heart
adorable.
right there.
He's great.
Well, listen, we're going to wrap this up, but what a
Thank
pleasure,
you.
Kristen.
Thank you.
Thank you
Thank you.
very much, and
Thanks, Darren.
thanks for your
Louie.
relationship, the
Yeah,
information,
thanks.
and the
Thank
partnership
you.
that we have with the St. Louis Blues, and we all appreciate that. So thank you very much for joining in. Great day. Enjoy the rest of your day, and take care of yourself, and get one of these
Yes.
AEDs, okay?
Get
They're
one.
inexpensive, they're red, and obviously
Lifesavers.
they're lifesavers. They are lifesavers. So thanks very much. Signing off for now.
Thanks. All right.